Welcome everyone to NRIG's November webinar. This is our last webinar of 2022. My name is Dr. Charlene Chu. I am an assistant professor at the Lawrence S. Bloomberg Faculty of Nursing, and I'm so pleased to be able to introduce our two guest speakers today who will be co-presenting this amazing work. So before we get started, I would like to start off with the land acknowledgement. So we wish to acknowledge this land on which NRIG operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. So as I read this land acknowledgement, I'm really thinking about the learning that's about to happen over the course of this presentation and the opportunity for Halyna to share her MN thesis, which is such an exciting time in a scholar's life. So as we are about to get started, the webinar is called Experiential Learning of a Respiratory Distress Management in the Immersive Virtual Reality Simulation. And our co-presenters are Halyna Yurkiv. She is a registered nurse whose master's thesis focuses on the evaluation of the immersive virtual reality simulation to help nursing students manage a respiratory stress event in COVID-19 positive patients. She's also an award winner of the 2022 Faculty of Community Services SRC Innovation Graduate Award at the Toronto Metropolitan University. Of course, this is an incredibly important topic as nursing schools have been dealing with having to support nursing students to get into these placements and to provide them with the adequate learning opportunities. And Halyna is presenting with her thesis supervisor, Dr. Cristina Catallo. Cristina is the graduate program director and associate professor at the Daphne Cockwell School of Nursing at the Toronto Metropolitan University. Dr. Catallo's program of research focuses on social media use and knowledge brokering practices among healthcare organizations whose goal is to target health policymakers and other healthcare decision makers. So thank you very much to the both of you for joining us today. Why don't I hand it off to you, Halyna?
Yes, thank you. Hello and welcome everybody, and thank you very much for joining today's webinar. As Dr. Charlene Chu mentioned, I'm a registered nurse working on continuing complex care unit and doing this for my thesis. And thank you very much for Dr. Catallo for joining us today. And we will focus on three things today. We will be uncovering the journey of the discovery and exploration of the immersive virtual reality simulations in nursing. I will also be sharing, along with Dr. Catallo, some key lessons learned related to utilizing this modality as an educational intervention for nursing simulations. And lastly, we will showcase the study that we've done, the immersive virtual reality simulation on respiratory distress, as a case of a feasible educational intervention that's capable of fostering learning, knowledge, and confidence in the undergraduate, third, and fourth year nursing students. So before we delve into the presentation content itself, I'd like to acknowledge my research team, Drs. Cristina Catallo, Soraya Sidani, and Christine Newman. I would also like to say thank you to our key stakeholders, Daphne Cockwell School of Nursing, Lumido Immersive Learning Platform, as well as Toronto Metropolitan University CNSA team, Students Affairs coordinators, and weekly newsletter team for helping us spread the awareness about this study. I would also like to acknowledge RNAO, Nursing Research Interest Group, for inviting us to present today. Okay. So to gain a better perspective of our beliefs, perceptions, values, or fears as a group in relation to the virtual reality simulation in nursing. I would like to invite whoever wants to participate in the word cloud activity. And I promise you don't have to answer any questions, physically, but you will be asked to provide a few anonymous responses. And just a quick summary of that activity: you are given a QR code that you can scan just using your camera roll, and it'll bring you to the website where a question is posed to you. So let me just go to the actual activity. The first question that we will ask you is, what are some of your hopes and wishes related to nursing virtual reality simulation in nursing? So while you think about that and submit responses, I'm just going to stop sharing my screen for a second and go to the word cloud activity.
Maybe we could post the code again in the chat.
In the chat.
Yes,
also, yeah. One second. Yep. Or maybe I'll just.
It's 4659.
Yeah. Mm-hmm.
And then 8. I forgot the rest.
8. Let me just do it. I don't have a chat option for me.
No.
But it's 46598215.
So the first question that comes up are, what are your hesitations, fears, and challenges related to virtual reality simulations?
And we have unfamiliarity. I guess that's the biggest one. All right. So I think we'll go to the next question then. Oh, people are still answering. Okay. So not as lifelike, novel, unfamiliarity. I think we'll just take them up. Those are some of the related to hesitations, fears, and challenges. And I think we will move to the next question, which is a little bit more positive. And it's, what are some of your hopes and wishes related to using virtual reality simulation in nursing?
For whatever reason, I can't access that question. I
You
don't know if
can't?
others have had that challenge either, but
Same, I also can't access it either.
I can't answer. Okay, that's fine. hopefully you'll have some hopes and wishes by the end of this presentation. I'm just going to check if more people responded to the first one. Difficult, unfamiliarity, novel, not as lifelike are the major ones. So I'm just going to go back to the presentation then. Hopefully by the end of today's presentation, we will be able to answer some of those burning questions. Oops. There we go. Okay, so how did this all come about? In the next few minutes, I'm going to be sharing a little bit of my journey with you of how did I find out about the immersive virtual reality simulation and how did we end up here doing the whole study on it. In 2020, I was in my last semester of final year of the undergraduate nursing program, and that was also when the COVID-19 pandemic started. all students were dismissed from clinical placements, but we obviously couldn't just stop completing our nursing studies. So students had to transition into a different type of learning, the online type of placement, where we had to engage in different alternative types of virtual learning to address that lack of in-person placement. And I cannot stress enough my appreciation and acknowledgement for all the hard work and massive shift in such a little time frame given for the nursing educators to come up with some alternative but also evidence-based educational tools to substitute that lack of clinical placement. That was done pretty much overnight. But I also want to share some of my personal experiences with two-dimensional virtual learning during that final semester of my last year in nursing school. Virtual simulations presented to students at that time, which was almost 3 years ago, were not just quite what I expected. You see, I envisioned them to be something that's Steven Spielberg's movie Player One. And so no wonder that my expectations didn't just match the reality. I personally didn't feel as engaged as I was doing them. And it was kind of hard for me to comprehend all that abstract knowledge and skills without actually having the opportunity to do them with my own hands, because I'm pretty much a kinesthetic learner. And I didn't really feel like coming back to that simulation later to try it one more time just to solidify that knowledge that it allowed students to develop. Multiple reasons could have influenced my experiences with two-dimensional virtual learning simulations. And number one could have been that there was a drastic change from taking care of 4 to 5 patients in clinical as a fourth-year nursing student to all of a sudden having to click just in a few buttons on the screen and provide nursing intervention to now a virtual patient. Another reason could have been just the general uncertainty and stress related to the pandemic, and also not even knowing if I will graduate this year due to the pandemic. And there was also probably the lack of general readiness to learn so much material online and not in person, having all these Zoom meetings, breakout rooms, and the list just goes on. But as I began to see I began to see these challenges and obstacles as a fourth-year nursing student as a window of opportunity. And I began looking up and Googling what are the different types of virtual simulations offered to nursing students out there. And that was mostly for my own preparation for NCLEX and just to complement whatever other students were using already, which would be your HESI or UWorld question bank. And that's when I came across virtual reality simulations. A few months into the pandemic, I also learned that I was accepted into the master's program at the TMU. And that was when I experienced my aha moment. I realized that I would really want to study virtual reality as a tool for nursing simulations to see if there are some educational benefits in using it. And so I did. And honestly, I'm still kind of processing how this all came about. So virtual reality is becoming a buzzword. You hear it everywhere. But what does it really mean? And what are all these different types of acronyms that also started to circulate around recently? You have the AR, you have the MR, you have the XR, VR. Do they all really mean the same thing? And as I started to dig deeper into what virtual reality really is, I found that VR is really just a small fragment of a bigger picture. And I thought it would be useful for those who join us today to just clarify the meanings of those terms, because I remember it was really confusing to me in the beginning because I thought they all meant the same thing. So in the next few minutes, we will be talking about this Venn diagram in the middle of the picture with all these different colored bubbles in it. So the biggest orange bubble with the acronym XR in it, which is also short for extended reality, is actually an umbrella term. And extended reality technology is comprised of those different other bubbles in the picture, which is your AR or augmented reality, your VR or virtual reality, and also your MR or mixed reality technologies. So what is extended reality technologies? Those technologies enhance or completely replace how we see the world. And the mechanism they use to do so is that they overlay or immerse computer text or graphics into the real world and virtual environments, or even a combination of both. Augmented reality, virtual reality, and mixed reality technology types share some overlapping features. However, they differ in the purpose that they serve, as well as the underlying technology that they use to overlay that graphic or textual information. And just to even complicate it a little bit more, some authors even go into differentiating various types of virtual reality specifically, and they base it on the degree of immersion that virtual reality provides. For instance, the famous subtype of virtual reality is called the immersive virtual reality, which provides the highest degree of immersion. And I'll just provide a little bit more details about this specific subtype of virtual reality shortly. So what are the differences between augmented reality, mixed reality, and virtual reality? Augmented reality technologies generate computer effects that enhance the way we see the real world. And they do that by using real-time photos or videos. So the specific mechanism of work in this type of extended reality technology is that you basically have to take a picture or a video, and then the AR application layers additional graphic or text on top of that video or picture that you took. And popular use of augmented reality technologies is seen recently in your Instagram filters or different AR apps like your Starfinder application. Then you have the virtual reality, or VR for short, and this type of extended reality completely replaces the user's entire field of vision, and it does so by using a computer-generated virtual environment or software. So popular use of virtual reality technologies is seen recently in gaming industry, your immersive exhibitions, as well as a training tool in healthcare education. And to allude to my previous point, virtual reality technology also has different subtypes in and of itself. And that's based on the degree of immersion it provides. So we have your head-based VR, which provides the highest degree of immersion. And this one uses images and it creates images and sounds that are projected to the user via the three-dimensional head-mounted device, which could be your Oculus, as you see in the picture, or another popular one is HTC Vivo. And in the literature, this type of virtual reality could be called head-based VR or your immersive virtual reality. And as you can tell from the title of this webinar, this was the specific subtype of VR that we used in the study. And also then you have your medium degree of immersion VR, which is also called a projection-based VR. And as the title implies, it projects images or sounds on a room wall, and different technologies can be used for that. And those can include large monitors, screens, or projectors. The recent example of the projection-based VR is seen in your immersive exhibition as the one in the picture, or you also have some of them being advertised like the Van Gogh immersive exhibition. And lastly, the third bubble, which is your MR or mixed reality. This one is really a combination of both VR and AR, and it's a mixed reality that uses a combination of the technologies discussed earlier. It can use your head-mounted device, it can use the projection, it can use both. And a famous example I can provide that use mixed reality is your Pokemon Go game, which was really popular a few years ago. Oops. And so we've learned that there are different types of extended reality and virtual reality technologies. And based on my experience with virtual learning as an undergraduate student, I've established that I'm particularly interested in the type of virtual reality that ensures the highest degree of immersion, and that would be your immersive virtual reality. This decision was based on a few factors, namely the question I posed to myself as an undergraduate student, which was, how can I learn how to manage a really bad situation or a deteriorating condition in the hospital if I never even got to experience it in the hospital? Another contributing factors that made me interested in this technology was related to the novelty effect of this technology, and also the fact that it was still hardly explored or used in healthcare education, which it still is, but it's getting better. I also found that unfortunately, nursing students were hugely underrepresented cohort of participants in the IVR research domain. And this is a general trend, as well as it's really bad in Canada. There's hardly any studies on this that involve nursing students or new graduate or nurses. My interest was also grounded in a lot of learning benefits that this type of virtual stimulation technology provides. And those also address some of my struggles as an undergraduate nursing student. In particular, research demonstrates that IVR simulations create a highly realistic, immersive environment that mimics hospital setting, but it doesn't require a user to be physically present in the hospital. Second, IVR simulations provide a variety of possibilities to learn different advanced nursing skills that you might need as a new graduate nurse or even a nursing student in an unusual situation. It also provides flexibility with scheduling training sessions, ability to have small group learning, and a high degree of engagement. And last, IVR simulations allow one to overcome fear and facilitate development of students' emotional intelligence, which is really required to manage a deteriorating situation, whether you just encountered it or you're actually managing it. So having some background research and a vision definitely helped. But the main question now became, how do we get there? And here's when Rogers' diffusion of innovation theory model, developed in the 60s, came into play. To summarize, this theory describes the pattern in which innovation spread or also diffuse in our societies, and that process of diffusion is dependent on the key players, which are your innovators, early adopters, early majority, late majority, and laggards. According to Rogers, innovators are those people who are open to the risk of trying new ideas. And honestly, thinking about conducting a study on immersive virtual reality simulations with nursing students during the pandemic, without having, access to so many softwares out there, felt really risky. And that was due to many reasons as well. And the first reason was that research demonstrates that IVR simulations in healthcare are a relatively new thing. And moreover, there's not a lot of studies with a large sample size that would involve nursing students or practicing nurses as their participants. Second thing was also that there's not that many IVR simulation software programs. And to my knowledge, there's only 2 Canadian companies that specialize in developing IVR simulations software for healthcare education. And this really limits your access to these products as someone who's interested in exploring this area of research. And also it limits your opportunity for collaboration, because these companies usually offer products that are really expensive. Bottom line is, it took some time to find other innovators, other IVR simulation software developers who would be willing to collaborate with you and who would allow you to run a pilot test of their product. And the last contributing factor was that researchers and educators unfortunately still represent most of them represent the late majority in the diffusion of innovation theory. They are slowly adopting this modality to foster learning, but and they are, and what is interesting, they are key players in diffusing this innovation, but they're still a little bit slow to explore and investigate this area of research and try to adopt IVR as an educational tool. So all this definitely impacted willingness to even take a risk and try and pilot this IVR simulation study. But nevertheless, this was a huge learning opportunity and a huge learning curve. So in the next few minutes, our component of this webinar will be focusing on presenting major lessons that were learned from exploring IVR simulations and using them as a tool in nursing education. So the first lesson, and I think most important of them, is that these experiences, for you to start doing something new, you absolutely need to have early adopters on your team. And early adopters, according to Rogers, they really don't represent that much of a population, like what you see in the as you see in the model in the picture. And but those are the people who are interested in trying new technologies to establish the usability and utility of those technologies. And I'd like to give a big shout out to my master's thesis supervisor, Dr. Cristina Catallo, and my research team, Soraya Sidani and Kristen Newman, and Daphne Cockle School of Nursing for believing in this idea of piloting this IVR simulation study on respiratory distress, and for providing me with vital sources needed to collect data and also to test this educational intervention. And Dr. Catallo will take over at this point and share other very important lessons learned from doing research in this area. So stay tuned.
So I thank you, Halyna. I think, Halyna really was navigating new uncharted waters in a way. This is still a developing modality, and it's still not really integrated, I would say, across nursing education. I know that I'm looking to do a study right now in the winter where we look at using this kind of modality with nurse practitioner students. So there's lots of room to grow here. And I think when Halyna was looking at it, we were kind of thinking about, how can we use IVR and keep the cost down? Because as a graduate student, it's not like she had thousands and thousands of dollars she could go off and spend to create a whole simulation that really fit with what she needed and wanted. We were really lucky that she found an organization that had won a big eCampus grant. So they had some simulations already, and they were willing to modify the simulation for her to kind of meet her needs. So that's one of the big lessons we learn, is that, some of the companies out there aren't as focused on education of healthcare providers, for example, may not have the simulations prepared. And, an organization may have to go ahead and pay for the development of the simulation. Or team up with researchers to help do research in it and have some funding that way. One of the most popular ones that are offered by some companies are, to teach CPR with or without a mannequin. But, if you want to come in and look at something like respiratory distress, like this is a very specialty type of topic. I would say too, like, it's still developing in terms of what you see. Like, it still feels very much like in development with the avatars that are being used is still really new. I think it over time, you'll see more lifelike and more, advanced modeling of the avatars and the equipment there. It still feels a little bit like not a cartoon, but it still has room to grow in that area, I think. So, Halyna really thought about her experience as an undergrad was very recent for her. So she kept thinking, how would a student, an undergrad student manage a respiratory condition if they've never had that experience? And it's very common in a clinical experience as an undergrad not to see everything and not to actually be exposed to things. It's the reality of what happens. You're only there on that clinical site for a little while, and if you get exposed to particular situations, great. If you don't, like, how can we supplement learning? So in this way, IVR can help meet some of those gaps and look at some worst case scenarios so that students can practice in a safe environment, and that, it helps with their preparedness. One of the things that Halyna looked at was a nursing burnout. It's something we certainly are seeing in practice. I know as a professor of graduate students, my students are telling me they're all frontline workers. Burnout is a reality, and it certainly became exacerbated during the pandemic. I know RNAO has looked at a survey where they looked at new graduate nurses, and they've reported high levels of stress, low levels of coping, and low adjustment to working. So that impacts retention, especially of new graduate nurses who are at risk of quitting the bedside. We see that in the news that we don't want to have students drop out of nursing schools, but they are, because it's a different environment that people are going into right now. And it's definitely one of interest, but one where the work is much different right now, especially, and I'm sure you're all seeing that as well. So here's where experiential learning in some way can really help, be it continuing education, supplement that can be used even when we're doing orientation of new staff. So IVR could really help with that. And another lesson would be to look at how to deliver IVR simulation, and so you avoid fragmented learning. So sometimes IVR is administered as an educational intervention, but it only teaches a small piece of what really real nursing work is like. And, obviously you can't do everything, but there could be more work in that area to kind of focus on integrating it more into a realistic aspect of what part of a shift might look like, and look at specific skills and how they might go together in terms of workflow. So that's still something that could be worked on and developed. And I'm just focusing here on time. There are other lessons that came up, but I'm wondering if we should maybe move ahead, Halyna, and talk about your results.
Mm-hmm.
Okay, so Halyna did quite an extent. So one slide back, you go back.
Yeah, try to figure that one out.
Yeah, no worries. So Halyna did a really cool study. She focused on the experience of respiratory distress as brought on by a COVID-19 patient who experienced respiratory distress. So this is a new condition, really. It's just more complex because of COVID-19. So most nursing students wouldn't have been exposed to this before. And we certainly have an urgency to prepare nursing students, undergraduate students, to effectively manage respiratory distress so that they can, begin to develop some level of competency as well as comfort with this. And this is where IVR can really come in handy. So her study really had two purposes. It was to determine whether or not IVR simulation can increase knowledge, perceived learning, and perceived confidence when managing a respiratory distress situation among third year, but also fourth year undergraduate nursing students. So we didn't look at second entry students or post-diploma students that were coming in from an RPN degree. We looked specifically at those who were in the 4-year traditional BSCN programs. So she focused on 3rd year and 4th year students. And she looked at the usability of IVR as a modality in itself. She did a pre-post test, a pre-experimental pilot study. She looked at Kolb's learning theory, and she was able to recruit 30 nursing students. So she had a great breakdown of approximately, 16 third-year students and 14 fourth-year students who were in the BSCN program. She had about 1 to 1.5 sessions that helped students set up and learn how to use the technology. Most people haven't been exposed to IVR, or they've done it maybe once or twice, unless you're like my 8-year-old who goes to immersive virtual reality birthday parties now, where now he knows all about it. He could come help us. But, you have to spend some time when you do this type of simulation, just training the students to even use it and to get used to the equipment and get used to using their hands and the hand controls for the equipment. I know when Halyna and I did it, it was sort of a learning process. So you need to build that time in.
But we didn't kill a patient.
No, we did. Yeah. yeah. So it's fun, Respiratory distress knowledge was collected. She used a pre-test and a post-test. There was a specific respiratory distress management test that she used. And then she looked at learning and confidence variables post-test. And then she looked at the particular intervention, how feasible, usable was this intervention. And she used a particular scale called the system usability scale. So she did, Halyna did collect some qualitative research as well. It wasn't just quantitative. She wanted to know whether or not IVR helped nursing students learn and develop their practical knowledge, especially when we consider a COVID-19 respiratory distress patient, and to look at what some of the gaps in knowledge students might say they have, and look at their anxiety. So she had, good results across her sample. She had a statistically significant change of moderate size when we consider knowledge scores from before doing the simulation to after. She had high mean scores when it came to confidence. So students felt more confident after having been exposed to that scenario, and a good level usability scores. So there were things that came out of it where, we could focus on making it more usable and feasible for students to use. At least this is an opportunity for students to kind of reflect on their gaps in knowledge and their skills when they're looking at this type of patient, or how to stabilize this type of patient. IVR can also help with supporting critical thinking and decision making. It certainly exposes them to types of situations they wouldn't normally get exposed to in clinical practice, so that they have some level of awareness of them. It also, can be used as a learning opportunity, a regular learning opportunity in curriculum. So that's more to explore, I think. So there's lots of things that can be done if we want to use it in a setting, whether it's a healthcare setting as a nurse educator, or in a traditional educational environment. So I think we're going to see more of this. So Halyna's study, she's working on her publications next. So I think it will be an exciting time for her. And that's it for main results.
Okay, so I think if everybody has any questions or comments, we're welcoming them at this point.
We could open it up for questions. Maybe while people are percolating, I can start us off. So thank you very much for that really engaging and very interesting presentation. Some things that stood out to me as a nursing professor, I can see the benefits of something like this, because certainly even in my classes, right, we have a distribution kind of issue around these experiences. As Cristina was mentioning about, there are some nursing students who will be able to experience a code situation and then others that don't. So in this way, it allows all students to be able to experience, managing a respiratory distress scenario, which I think is really beneficial overall, just to have that exposure. So I also really appreciated the gap in research that you found, which was that nurses aren't involved in creating some of the tools that are out there, and that nursing students themselves are not involved. So maybe my question to you then is around, so I have some questions around the actual study itself, but are you thinking about how, co-design or any of the user-centered design principles might come into play when you're thinking about what IVR might look like for nurses and nursing students?
So even though we only had one open-ended question, we gathered some rich data because we also encourage students to provide their feedback. How can this tool can be improved? And so we have some recommendations regarding content, regarding the complexity, regarding the interface, like user interface. So those things I guess we will be publishing soon. They will be some of the recommendations. So yes, because it's a novel thing and people are still beta testing, it still kind of looks gimmicky, but I think the way to address this is to stay away from that fragmental learning and just to have like the holistic scenario that mimics the nursing flow as best as possible. It would be nice to include like nurse practitioner students or like other nursing students in future studies to see what is the really gap, or like really explore those quantitative tools, data that we collected on those quantitative tools, to see, okay, so what was specific about this simulation that contributed to your confidence or to your learning, because we didn't really have that much data on that, and that's something we want to study more.
And even the generation of the different components that are within the scenario, I think too would be really interesting. Could you talk a little bit more about what the actual intervention was, like what the actual exposure was? If you didn't show any screenshots, but like, could you just sort of give us a description of like what it looked like or what they're actually doing, and like talk us through what the scenario was?
Yeah. So again, just going back to that point, there wasn't a perfect scenario that I wanted, and so we had to work with what we had at hand, and we had to tweak it a little bit. So we used actually 3 different lessons provided by that Lumido company, and we combined them into one to have that continuous flow. So, and that would involve a variety of skills you would have to know when you have to care for a COVID-19 positive patient who might later experience respiratory distress induced by COVID. And so first thing that students had to do, they had to learn how to, or rather review, because it's a 3rd and 4th year students already, but they had to really solidify knowledge on how to don and doff necessary PPE when you're caring for COVID. They had to tell you what kind of precautions the patient's on, and they had to rationalize it. So not just, okay, yeah, he's on precaution because there's a sound. Why is he on that precaution? Do you know what's the difference between droplet and contact and airborne? So I asked questions like that. And once students were comfortable with donning and doffing, they will then transition to a different lesson where they had to perform focused nursing assessment, a respiratory assessment on the patient, because that was the first time they encountered the patient, and they didn't really, the admitting nurse did the assessment, but as a nurse you have to still come and do your assessment if you've never seen a patient before, especially. And that at that time the patient was stable, so they did all the assessment, and they had to, but they didn't know the patient was stable. The thing was, they had to interpret their findings. So that's your additional critical thinking and decision-making component. And there were many tools tools that they could use, the vital sats, the stethoscope, and they had to differentiate between normal and abnormal lung sounds. And that was, I think, the piece that they really liked. And then finally, the scenario was that they go on break, and then after the break, they do their nursing rounds, and they find patient in a respiratory distress episode. And what do? So they walked in, all the alarms were beeping, so that created some sort of like anxiety. Okay, what do I do? Like, do I call the code? Do I yell? Do I do something? What can I do as a nursing student? So they were not asked to do anything that's not within their scope of practice, but what can you do as the first person who've seen this patient in COVID-19 respiratory distress? And it all comes down to your basic things like, okay, well, raising the head of the bed, checking the environment safety, calling the code, and then what can you intervene? So, they had to obviously see that the patient is kind of choking, suffocating, so they had to suction before giving the oxygen. And then giving the oxygen, and then also they had to sort of learn how to involve the interprofessional team in it, because it doesn't just stop at the intervention. You have to update a whole bunch of people now on your team. So they had to contact the nurse practitioner on call and just relay the information of what happened using the ASBAR format. So there's a combination of different skills and competencies that you need to know. And it was a little bit complex, maybe to some, maybe not to others. We had different feedback.
And those critical decision-making junctions during that scenario, how did you know what the student was thinking? Is it like a talk out loud that the student has to do, or is it, a multiple choice question that comes up? Like, how do you judge that, or how do you know what the student is going through as they are working through the scenario?
Yeah, so we did have some pauses. Just a student had an opportunity to be like, okay, time out. I need a pause. I don't know what I'm doing. And we had to I had to kind of probe them. Okay, well, what would you do? Well, look around. What kind of equipment do you have in front of you? What do you think you can do? So it was a stressful situation, because after the 5-minute point, the patient just the patient is unresponsive, and saturations drop, your heart level really goes up, because those are some of the symptoms of respiratory distress. Your respirations go down, and so that's freaky when you see those numbers on the monitor. You don't know what to do. So we didn't have specific qualitative questions to ask, okay, at this cutoff point, what were you thinking, what were you going through? So I think that's the next step of our study, to have more open-ended questions and dig a little bit deeper of what was going through your mind at that point. But we only collected data at the end, after the intervention.
So you allowed the students to work through the scenario, and then you did while the scenario is happening, is it it sort of sounds like an unfolding case study in some regard. So are there points in time where they need to explain what they're doing or rationalize their nursing judgment or anything like that?
So that was mostly happening in our debrief session.
Afterwards.
We practically didn't stop during the simulation, just also to be mindful of the time, because Oculus recommend to wear the head mounted device only for 30 minutes. Mm-hmm. So we didn't have those cutoff points, and to allow students to debrief while in the scenario. We had that debrief after.
Great. And you also mentioned that you had 3rd and 4th year students. Yeah. Did you see any difference between the two?
No, there wasn't really a difference. And we also, in a demographic survey, we asked, are you a gamer? Because you kind of think, okay, if you're a gamer, you're doing this all the time, you're used to hand controls and the technology in general. How did you do? And we didn't there wasn't really a difference in knowledge. We also looked at the GPA, and there wasn't much difference. So that's helpful to know that the respiratory distress knowledge test still was able to induce a change that's statistically significant. And we also looked at we asked in a demographic survey, did you have any type of virtual placement or experience as an extern in the past? And This I should clarify. So the inclusion criteria for this study was that if you experienced or have seen someone managing a respiratory distress in the hospital, you're not qualified to participate in this study because that pollutes, the data. So even having, some experience, they had a variety of different experiences as personal support workers or clinical externs, but they still found this study helpful. So I'm happy about it. I'm happy that it still contributed to their learning and confidence.
Yeah, it's wonderful. Does anyone else have any questions? I have several questions. I could keep going. Does anyone else have any questions? We can open it up. Maybe thinking about the future of this area of research using VR in nursing education, where do you sort of see this going? Do you see it being implemented more in general, or what is your thoughts around that?
I think my end goal with this is to really try and test, can this be facilitated from home?
From home?
Do you have to come physically on campus? Because if we have, other pandemics where students are not allowed on campus, or we have, problems with securing nurses, in remote areas up north or elsewhere, can we provide those type of learnings with individuals who live far away, who are having troubles with commuting? Can this be a complementary type of experiential learning opportunities we offer to students?
Oh, interesting.
I think you have to have really clear objectives when you're using all of this. Like you have to have purpose.
Yeah.
And then you have
that's
to
just
think
the
about
general big idea.
Yeah, I like
there's
the
many
idea.
steps
I think
to
it's
it.
cool. But if
Yeah.
you're using it at all in education, like it needs to be purposeful. It can't just be, okay, now we're going to do this today, because it takes a lot of resources just to create the kind of scenario you need. So there'd be cost up front.
Yeah.
And I think it's still rudimentary in terms of what you see. So I think to make it more lifelike, where it's more like a movie, there's more that needs to be done there. So I think, it's different than, say, the learning you would do with high fidelity models or mannequins. So it's a different kind of learning. You'd have to approach it that way. You have to have a purposeful plan, know exactly what you want to test in terms of elements of learning so that the student understands it and they're kind of not distracted by playing with it. Otherwise, you're just going to end up, it's not going to be as impactful as you need. So there's still a lot, I think, that needs to be done if it's used as an actual education tool.
Yeah, to be like integrated across nursing curriculum, maybe in a few years, but I don't think it's there yet. Just like thinking about the feasibility, if you want to teach fragmental scales, I mean, sure, it definitely saves you on all that plastic that you're using, and models are fairly expensive. And some studies even show that, VR is even cheaper than your mannequins. But
it would be, because they're thousands of dollars, like sometimes $40,000-$50,000. Like they're really expensive.
But then you're also thinking, okay, well, how am I going to deliver that head mounted device to a student? Maybe as those devices get cheaper, more people are willing to buy them and use them, not just for the learning purposes, but also for leisure activities. So the accessibility will be higher, but right now it's just it's just a big idea, and we need many steps to get there.
And I'm sure that this research will form a really strong baseline to start building some of this research in this area, which I think is important, as we were talking about, for equity, for nursing experience, and really just to improve care overall for patients. So thank you so much, Halyna, for coming and speaking about your work. Congratulations on completing your MN. And thank you so much, Dr. Cristina Catallo, for coming as well. Just taking note of the time. Thanks to everyone for joining today. Please join us at our next webinar, which will be in 2023 with our very own Dr. Amanda McIntyre. She's the co-chair of NRIG, and she will be talking about her PhD thesis that she is currently defending. So all the best, everyone, and thank you all. Thanks.